really need to get to the root of the problem and then place the filler product.
Okay, we are out of time, but we have time for a few more photos. Let's take a look.
Let me tell you, I'm going to take you through.
And these are all weekend lift?
Absolutely.
Quick lift, you call it?
Yes, I do. I want to show you one gal. These are shot 2 days after her procedure. You ask me, what's the downtime, what to expect with pain and so forth. The reality of it is, if you notice her preoperative photo, okay, she has the typical signs of aging. This is an older patient moving towards the 60-year-old age group with extra skin in her lower neck region, sallow or hollow cheeks underneath the eyes, nasolabial folds. These folds are developing. We have performed her procedure. Look at her post-op and how dramatic. This is a beautiful woman.
That is dramatic.
And this woman
looks like her daughter.
Absolutely.
I think anybody would agree with that.
This woman had lost her husband, kind of had some sadness in her life for a long period of time, and decided she wanted to do something for herself. This is what we were able to accomplish with that. And I want to show you.
And go ahead. I
just want to show you a few more of her, because to me it's such a dramatic change, and it's not a plasticized change.
Is that the way she used to look? Because if I saw her walking down the street, I wouldn't say, boy, and I pride myself. We talked jokingly, and I said, I could spot a great facelift down the street.
Right.
And you said, I challenge you if I could see yours, but that's good. I guess it doesn't look pulled.
It doesn't look pulled. It doesn't look fake. It took away all the signs of aging. Plus, it gave her a look that...
but she looks different.
She looks pretty.
But is that the way she used to look? Like if she looked...
Absolutely. If you look at old photos of her and so forth. But that is many years ago. If you go back 15 years, you'd see this type of a face. And it's not the over-plasticized...
That is dramatic. That's 15 years. Almost 20 years.
But here's the key. You ask, what can this lift do? Look at her neck. Look at the preoperative element of her neck and how much extra skin tissue there is and how much fatty tissue there is. This woman was shown on a CBS affiliate in Phoenix 2 days after her procedure. These are the photos that were taken at that time. So,
I mean,
that
very
is that.
pretty, very
it's 2 days
attractive.
out. Let me show you one other facial procedure here on an older woman. We're in our 70s now. We're talking about a patient in her 70s. Here's her preoperative look with all of her excess skin tissue, her sallowness, her hollowness, the hollowness underneath her eyes. Look at how soft and pretty she looks post-operatively. Not over-operated, just took the signs of aging away to soften her appearance.
And the downtime is
minimal. Here's a 70-year-old female that is back and up and about in a week grocery shopping. So, you know, you have to look at that and say, how much are we taking away from their lives? Look at this 3/4 shot.
Nice neck.
Beautiful. And so can you accomplish this?
So that's not a full facelift?
It's not a full facelift. This is a minimally invasive lift where we do our anchoring and we anchor the mid-face up.
And it will last
as long
as I mean, it's just going to fall like the rest of your face.
Absolutely. It will last as long as any facelift that's available to. This is not a skin-only type of lift. We address the neck with this. And
so you're looking at muscles, the fat.
Absolutely. Okay, another photo. Preoperatively, this woman was, she's in her 60s and so forth. She is a very active, athletic female. So her body is in different shape than her face, and she's lost a lot of fatty tissue in her cheekbones and so forth. Her eyes are very asymmetric, meaning they're different shapes. We did a lot to her. We went ahead, she came in from Boston. We went ahead and did the lift. We went ahead and did facial fillers to her cheekbones.
Incredible.
We had corrected her eyelid problem, her neck and so forth. This woman looks like a different human being in the fact that we've corrected the things that were her deficit. She doesn't look plasticized or overdone. See, she looks soft.
I'm noticing in all of these photos, they don't just look younger. I mean, this one is about 20 years younger,
right.
And I think anybody looking would agree, but they look prettier.
Absolutely.
It's a pretty look. It's very, very nice.
It's soft, is what it is. So we've used...
You call it soft, okay.
It is. We've used facial fillers, we've used Botox, we've gone ahead and done her eyes in conjunction with the lift and some liposculpture of her jawbone. So that's a...
Do you see their personalities change?
Absolutely. It's like they flower. They really do. They're a lot of the sadness or internal angst or whatever it is that people have to deal with on a daily basis. I think that they do much better if they look at themselves when they wake up.
So when you see them on the follow-ups, they act a little differently?
Completely.
Do they tell you they're more social, they date more or whatever?
Absolutely. We see that all the time. It's a nice adjunct.
You like this. You like this.
I love what I do. I feel like we're able to make some just very positive changes for people, and I really enjoy doing it. Randy, I just have a few more pictures I'd like to show you. This particular female came in. We only had a short period of time. She was vacationing in Phoenix, had 2 weeks with her daughter, came in from out of state. And we realized to go through a full facelift, it really wasn't required, but what we needed to do was enhance her chin, basically use some fatty tissue for filler, and do a full face fat transfer. And we were able to accomplish what looks like a facelift in a very short period of time with just fat transfer and chin implant.
Very
and
nice.
some liposuction of this jawline just to kind of correct a few of the fat depositions through here. Very big change. The other thing is we will go ahead and we'll fill lips and give good lip contour.
That's a good example.
With our procedures, because I'm a believer that you should have good
A lot of lips overdone.
Way overdone.
At least in my opinion.
Way overdone. And I don't like that artificial, blown out, look like a fish type look. I like.
But some people
good
must
contour.
like that because you see it everywhere.
I think they think that is the look you're supposed to have because that's commonly done by a lot of ancillary people who inject lips.
Do you have guys, colleagues, other surgeons that love that look?
I see it produced by other surgeons all the time.
You think they like it?
They must. They're
Is it
doing
patient driven or surgeons driving that? I often wonder that.
You know, I think it's media driven. You look in the media,
see.
you see many people that are out, many movie stars that are out in the public with these overblown.
So you
lips.
don't do it?
I'm not
If
a
somebody
believer.
says, Dr. Kotoske,
No. What I like to do is I like to have a beautifully contoured lip with a good Cupid's bow. That's the structure. Just a nice shape and form with a little bit of flip, and give it a
so
sexy
if you want
look
an
without-
unnatural look, you're the wrong guy to go to.
Exactly.
Okay, all right. Very interesting. I want to thank you for coming on the show.
Oh, you bet.
Some
I've enjoyed it.
final tips, by the way. Yeah, I
Okay.
mean, women, I guess there's perceptions out there with aging men, aging women about what needs to be done. Where does somebody begin? They're starting to not like the way they look.
Where does somebody begin? They need to be educated. They need to educate themselves. So the first thing you would do is you need to do some research. You need to get on the internet and start looking at the procedures that you're interested in. You need to start looking for a physician. You do that by getting online and looking for physicians in your area or wherever it is that you'd like to have your procedure. You then go to the board and you actually investigate that physician to determine.
right?
Absolutely. I think it's quite important to look at their records, know what type of work they've been doing, how long they've been doing it. Find out if they're department heads, if they carry any type of educational background where they are professors of plastic.
You were a professor?
Absolutely, of plastic and reconstructive surgery as well as head and neck. I'm also a national lecturer, which I think is important for people to realize that you need to go to people that are involved, that are interested in learning and furthering their education. So I think being a national lecturer, I think being an individual that's training other physicians to do procedures is a good way to validate.
How important
who
is
does it.
rapport? Liking your surgeon?
I think it's huge. I think it is huge. I think that you really need to develop a bond with that individual and trust them that they're going to do the right thing for you. But that only comes from all the preamble.
I talked to one of your
research.
staff. They said, oh, they love Dr. Kotoske. It's like a trick question. I say, so do the patients like him? And I always see if there's a hesitation, but
Right,
without hesitation, they love Dr. Kotoske. It's nice.
Well, it is nice. And I think it's important to have satisfied patients because that's the only way that you build your practice in this environment today.
Okay, great. Well, I want to thank you for coming to the show.
You bet.
Very interesting. Always a
You bet.
pleasure.
Thank
Been
you.
watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online or direct a friend to watch it, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.